very much, Kirby. So they show this funny video, and then I got to follow Kirby Wilbur, and I got to tell you guys about what's going on in Washington, D.C. I got to tell you, I kind of feel like Zsa Zsa Gabor's seventh husband on their wedding night. I know what I'm supposed to do, and I'm going to try and make it interesting for you guys. What's going on in D.C.? I mean, what I'm going to do is just kind of give you the background of where we stand with this legislation and this bill. A little civics lesson. First of all, there's the House, there's the Senate, Washington, D.C. Bills have to pass out of both those bodies, then they have to go to a conjoint committee. The bill has to be agreed upon, then goes to the White House to be signed by the President. So where we stand right now, there are 3 committees in the House that looked at this legislation. Each committee passed the bill out of their committee strictly along party lines. The House went on recess 2 weeks ago. That Friday afternoon, the 3rd committee passed the bill out. So the House has done it. When they come back from August recess, they're going to debate the bill on the floor. The bill is H.R. 3200. It's 1,018 pages. And I bet you guys can guess how many of those representatives in Congress have actually read that legislation. Okay, now on the Senate side, there are 2 committees that actually look at health legislation. One is the Health Care Committee, and actually it's the Health, Education, Labor, and Pension Committee, or HELP. Now, if you think these guys are helping the country, you got to think coming. Anyway, that's the Kennedy-Dodd Committee, and they have passed out a bill. The bill is, it's called the Kennedy-Dodd Bill. That runs to only about 760 pages. But in just a second, I'll tell you what's similar about that bill and the House bill. The second Senate committee is the Finance Committee, and that's Senator Baucus's committee. And they could not come to any agreement before the Senate went on recess a week and a half ago. They are tasked with getting something out when they come back. Now, there is some speculation that the Senate Finance Committee may not even get a bill out of committee. That's the bad news. The good news is that means the legislation goes away. It's 1993, and it's Hillary Carroll over again. The really bad news is they're talking about some kind of a compromise. So we have to stay tuned on that. But anyway, that's where the legislation stands. Now, in H.R. 3200 and in the Kennedy-Dodd bill, there are some similarities. And there are 7 or 8 really important things that you folks need to be aware of. Some are good, some are not so good, some are terrible. It's like the good, the bad, the ugly. The good, there's about one thing that's good in both of those bills, and that is they call for more transparency. Now what they mean by that, well, I'm telling you, this is the good, right? By more transparency, that means that you as a patient, when you go into a doctor, you go into a hospital, the doctor's got to tell you what the pricing schedule is and what the benefit structures are, so that you have a clear idea. It's like when you go into QFC, you know what a pound of hamburger costs. When you go into Safeway, you know what a loaf of bread costs. You go into your doctor's office, you don't have a clue. Well, with more transparency, you would. And I think from a free market standpoint, in patient education, that's good. That's a good thing. Now, the bad. And there's plenty of bad things in this bill. First of all, there's an individual mandate, which means that every citizen, every adult over the age of 18 has to buy health insurance. That may very well be unconstitutional. And if that does pass, my guess is this will go all the way to the Supreme Court and be challenged. The second thing is an employer mandate. And by an employer mandate, what that means is that if you're an employer and you have employees, you have to provide health care benefits. You are forced by law to provide health care benefits for your employees, or you pay an 8% payroll tax. So this is called pay or play. You either play by providing the health benefit, or you pay this fine, 8% tax. There are some other things that look good, but probably are not that great. Health information technology, electronic medical records. The administration is touting these things as being huge cost savers. They're not, folks. The Congressional Budget Office looked at them and they said, no, these things are going to save less than 1%. Now, they may be good patient care, but they're not going to save us any money. What is not in these bills is any kind of significant Medicare reform. And Medicare is the freight train that economically is going to take this country off a cliff. There is no significant Medicare reform. There is an expansion of Medicaid in both bills. Okay, that's the bad. Here comes the ugly. There are two things that are really, really ugly in these bills. You've probably heard about them. One is called a connector, or an exchange. And what that is exactly is a government bureaucratic committee sitting in Washington, D.C., passing judgment on every health insurance plan in this country, telling you what price it can be and what benefits you have to put in there. And then through that exchange, these will funnel down to the American public. That is really bad. Massachusetts has had a connector since 2006. They did it so they could have universal health care. They don't have universal health care, and the state of Massachusetts is $1 billion upside down now. Now, the difference between Massachusetts and Washington, D.C. is Washington, D.C. can print money and go into and run a deficit, whereas Massachusetts can't. So the connector is going to be tragic for this country. The last thing I want to mention here, which is really, really ugly, is the public option. And what the public option means, folks, is the government will price a health care policy with the exact same benefits as private insurance, and they will underprice private insurance. And I speculate within 3 to 5 years, we will no longer see private insurance in this country. And you're sitting out there and you're saying, Stark, come on, there are a lot of really smart people in D.C. How could that actually happen? In 1964, there was a vibrant market for health insurance for senior citizens in this country. Over 65% of seniors had private health insurance in 1964. Medicare was passed in 1965 as a public option. And by 1970, except for deductibles and co-pay, there was no private insurance market for senior citizens. So if you think I'm crazy, all we got to do is look at Medicare, folks. The public option will destroy private health insurance in this country. With that, I will stop. I look forward to your questions. Thank you very much.
Medicare is about 10 times as expensive as they projected at the time as well. Cost has gone way up.
It was 10 times within 25 years.
Within 25 years, it was 10 times as expensive as they predicted by 1989.
Yeah, yes, exactly.
10 times what they thought. So when they tell you it's only going to cost so much, keep that in mind, folks. Those folks on the side, there are seats available if you folks want to sit. If you've got an empty seat next to you, would you raise your hand, please? If you guys want to take 30 seconds to find a seat, please. And again, I thank all of you for coming too. We didn't think everybody would show up, but y'all did. Thanks. You must care about this issue. So look for the extended arms, and there are seats. Our second speaker tonight is Dr. Michael Schlitt. I've known Mike for a long time. For those of you who used to listen to me when I was on in the old days, when I was young and on at night, we used to do Healthcare Wednesdays. And we heard that Hillary was coming to town, and Michael looked at me, and I looked at him and said, well, we should welcome her. And so we talked to Catherine and a few other people. We thought, we'd get 25, 30 people out and have a little picket line. And, well, they had 700 people. We had 1,500 people. The rest is history. So I've known Mike for a long time. And I can tell you this, I know him well enough that if I needed a neurosurgeon, I would trust him with my life and life of my family. And I don't think you can pay any higher compliments to a doctor than that. So